Clearcanal Earwax Softener 6.5% drops is used to treat earwax buildup. It softens, loosens, and removes the earwax, which can block the ear canal and reduce hearing. When applied, this medication releases oxygen and starts to foam, which helps break up and remove the earwax. It is important to consult with your doctor before using this product in children younger than 12 years. The recommended daily dosage and optimal timing for using this product should be determined by your healthcare provider. When using Clearcanal Earwax Softener 6.5% drops, it is important to only apply the medication in the ear, typically twice a day or as directed by your doctor. Do not use this medication for more than 4 days at a time unless instructed by your doctor. To ensure the right amount of medication is given and to avoid touching the ear with the dropper, it's best to have another person administer the drops if possible. Before applying the ear drops, it's important to wash your hands. To prevent contamination, avoid touching the dropper tip or letting it touch your ear or any other surface. Lie on your side or tilt the affected ear upward, then hold the dropper directly over the ear and place 5 to 10 drops into the ear canal. Keep the head tilted for several minutes or insert a soft cotton plug in the ear. If there is any wax remaining after treatment, it may be removed by gently rinsing the ear with warm water or using an ear syringe with a soft rubber bulb. It's important to consult your doctor or pharmacist about using an ear syringe safely. After using the drops, it's important to not rinse the dropper and to replace the dropper cap. It's also crucial to avoid getting this medication in your eyes, and if this occurs, rinse the eyes thoroughly with water. If your condition persists after 4 days of use, worsens, or if you believe you may have a serious medical problem, seek medical help immediately. When using Clearcanal Earwax Softener 6.5% drops, it is rare to experience side effects. Your doctor has determined that the benefits of using this medication outweigh the risk of side effects. Most people using this medication do not experience serious side effects. However, if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you notice any other effects, contact your doctor or pharmacist. There is no complete list of possible side effects, so it's important to consult with your healthcare provider. Before using Clearcanal Earwax Softener 6.5% drops, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. If you have other ear problems or are experiencing dizziness, it is important to consult your doctor or pharmacist before using this product. Additionally, if you are pregnant or breastfeeding, be sure to inform your doctor before using this medication. The recommended dosage for Clearcanal Earwax Softener 6.5% drops is to use 5 to 10 drops in the ear, twice daily for up to 4 days. It is best to use this medication at bedtime, allowing the drops to remain in the ear for 3 to 5 minutes before draining. When using Clearcanal Earwax Softener 6.5% drops, it is important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It is essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is important not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If swallowed, this medication can be harmful, and an overdose can lead to serious symptoms such as passing out or trouble breathing. In such cases, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can reach out to a provincial poison control center. It's important to keep this medication out of reach of children and pets to prevent accidental ingestion. Always follow the recommended dosage and store the medication in a safe place. As with any medication, it's important to use Clearcanal Earwax Softener 6.5% drops only as directed by a healthcare professional. It is important to note that Clearcanal Earwax Softener 6.5% drops should not be shared with others. This medication is specifically designed for individual use and should not be shared with anyone else. Sharing medications can lead to potential health risks and complications for others. It is important to use this medication responsibly and only as directed by a healthcare professional. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then skip the missed one and take the next dose at your usual time. Do not take a double dose to make up for the missed one. When it comes to storing Clearcanal Earwax Softener 6.5% drops, it's important to keep it at room temperature away from direct sunlight and heat. Be sure to refer to the storage information printed on the package. If you have any questions about storage, don't hesitate to ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it comes to disposing of this product, it's important to do so properly. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Make sure to discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.